Typically, an egg freezing cycle will cost between 16 and 20,000 dirhams. This does not include the cost of the medication because some girls will require low dose of gonadotropin injections, which are typically required to stimulate the ovaries. Other girls might need much higher doses. So we don't include the cost of the medication in the overall process. Obviously, the earlier the better, because when you're young, you have lots of eggs, your egg reserve is high, and your egg quality is better. But most girls wouldn't want to freeze their eggs too early because most of them would anticipate getting married and being able to have children early in their marriages. But if you've reached 32, 33, or 35, haven't found Mr. Right, that's when most girls start thinking of egg freezing. The first thing they do is, of course, check their anti-Mullerian hormone, which is a measure of egg reserve. And the girls we see, most of them come to us in a panic when they've had this test and found that their egg reserve is low. So obviously, the earlier you start, the better. Now, at the other end, after the age of 40, 42, egg reserve is very low and egg quality is poorer. I'm talking about chromosome content of the eggs. So obviously you wouldn't want to delay it for too late, but if someone wants at a later age to also freeze her egg, as long as she realizes that her egg quality is going to be poor, I will not stop her. Well, first of all, she needs to take the decision. Once that decision is made, we need to assess what is her egg reserve. So you would do an ultrasound scan to see how many antral follicles are present in both the ovaries. You do an anti-Mullerian hormone to see how many eggs are there in the ovary again. Based on this, we would plan out how she would be stimulated, exactly what dose of medications we would use. Apart from that, if there's any other medical problem like a thyroid or a PCO or any of those things, they need to be addressed and controlled. If she's overweight, it would help if she lost weight. If she's smoking, she needs to stop. Technically, indefinitely. Once they have been frozen in liquid nitrogen by a process called vitrification, they can be left there forever and ever. As long as the liquid nitrogen keeps getting replenished, they can be there forever. In the UAE, the government federal law permits us to freeze eggs initially for a period of 5 years. At the end of those 5 years, if the patient or the lady so desires, she can extend the freezing for another 5 years. This process was initially introduced for young girls who hadn't completed their families or hadn't started their families, who had been diagnosed to have some form of cancer and were scheduled to undergo chemotherapy and radiation. So the idea was we had a 2 to 3 week window whereby before she started her chemotherapy or radiation, we would stimulate the ovaries, get her to produce as many eggs as she could, harvest the eggs and vitrify them so that once she's had a chemotherapy, she's almost certainly going to become sterile after the chemotherapy and radiation. But recently, it's become this whole process or the indication has been extended to social reasons. Girls are getting married later, they have their careers to sort out, they haven't found Mr. Right. So these are the girls who are essentially coming to us saying, let us have some kind of an insurance policy before we become older, over 38, 39, when our egg numbers are going to decline and our egg quality is going to be much poorer. So while we are younger, still waiting to sort out our careers and marriages or find the right partner, let's freeze our eggs. So social freezing is very common now. So the procedure typically starts on the second day of the menstrual cycle. We start stimulating the girl's ovaries using a series of injections. It's a daily injection. It's given through a pen. She self-injects. It's almost painless. During this time, she undergoes 2 or 3 scans to see how her follicles and eggs are growing. When the follicle and eggs are ready, we would harvest the eggs through the vagina. So there's no cuts. It's done under sedation. She walks out 2 hours later and is back at work the next day. So that is the process. Side effects that she can experience, the pain of the injection. Little, it's a very fine needle, so it's very minimal. There's a little bit of bloating. As the ovaries are becoming larger and full of large follicles, they will feel a little lower abdominal pressure, they'll feel bloated. Some girls complain of getting a little emotional during this time, but nothing extraordinary in that. And essentially, that's it. So this is completely understandable socially and culturally in the part of the world that we live in. Unmarried girls in this region wouldn't like to have a vaginal procedure. So rather than, we would do the ovarian stimulation in the same way. And for them, what I recommend is a transvesical through a full bladder, or just directly through the abdomen. We approach the ovaries abdominally, so we don't interfere with the vaginal area at all, and we are able to collect eggs. The harvest is definitely less than if we had done a vaginal egg collection, but it's a win-win situation. They didn't want a vaginal procedure, but they wanted to freeze eggs. They get both. Well, the outcome is going to be defined by the eggs that you froze. What was the number? What was the quality? The younger the girl, the more the eggs, the better the quality. The older the girl, the poorer the eggs. So it's clearly at what stage did you freeze them. What you thaw when you want to use the eggs is essentially exactly what you froze, because of this new technique called vitrification. It's not really new, it's about 10 years old, but with vitrification, when you thaw eggs, you get them exactly as how they were frozen. We recently had somebody who had frozen eggs 7-8 years ago, where she wasn't quite confident about the gentleman that she was going out with. When she decided that this was the right person, and they had got married, they tried for a year or so by themselves. She didn't get pregnant, but she had frozen young eggs at 7 years ago. We used them. She's now the mother of twins.